In the absence of those mask mandates, public health officials in the western part of our region are urging people to take it upon themselves to mask up and prevent viral spread. The Northwestern Health Unit and a number of hospital CEOs sounded the alarm today about the impact of rising cases of respiratory illness, particularly on ERs and pediatric care. Lee Noonan has the story.
With waves of COVID, the flu, and RSV hitting at the same time, public health officials in the western part of the region are imploring the public to protect themselves, each other, and the healthcare system itself by wearing masks, getting vaccinated, and staying home when sick or when there's illness in the home. Medical Officer of Health Dr. Kit Young-hoon says the worsening situation could have drastic impacts on the area's healthcare system.
In recent weeks in our region, we have seen a rapid increase in hospitalizations and emergency department visits for respiratory illness, particularly for children. Based on this information, we are facing a potentially difficult winter season. And now is the time to take action to dampen the surge in respiratory illness that is beginning to occur.
With rates of respiratory illness only expected to increase, CEOs of 3 area hospitals spoke up about the impact it could have on hospital capacity.
We are often 1 or 2 sick calls away, either physician or staffing wise, from having to close. So very important to protect our patients and our community and our healthcare providers.
People still have heart attacks and strokes and those sorts of things, accidents and whatnot that need to be cared for. So there has to be capacity in the system to care for the normal things that go on with people outside these, enormous surges of 3, in particular, respiratory illnesses.
You're not going to get mandated, but we would ask you to seriously consider that as a way of protecting you and your families and protecting our capacity, because we do need it for people who require service. And if we get overwhelmed, there will be people who need service that won't get it. And that's what I worry about the most.
In particular, officials are concerned about the health of young children. Reset says the proportion of kids under 16 in his ER has increased from 14% last month to 25% so far in November, mostly with respiratory conditions. Lee Noonan, TBT News.